So joining us is Dr. Tamara Beckford. Dr. Beckford is a wife, mother, and board certified emergency physician with over a decade of experience working in emergency rooms across the country. Most recently, she's been on the front lines battling the surge of COVID-19 in our community. So thank you so much, Dr. Beckford, for your work there. Also, when she, in her free time, her spare time, I don't know where her spare time is, but Dr. Beckford also hosts the Docs Who Care podcast, where she interviews doctors from across the world who share their practical self-care and wellness tips. And joining Dr. Beckford in conversation will be Quinn Conyers. Quinn has an impressive history as a professional speaker and MC. She has spoken with organizations like Nike, Maryland Public Television, the National Association of Women Business Owners, Meeting Planners International, and the Black Speakers Network, to name a few. She's also the author of 2 books and has auditioned 4 times and made it to the final rounds of Shark Tank. So very excited for you to be here, Quinn, as well. And with that, I'm going to turn it over to you both and have a great conversation.
Thank you so much, Rob. I appreciate the kind introduction. Again, welcome, welcome, welcome. I'm excited to be here. It is literally International Women's Day. And what better way to have a conversation with Dr. Tamara Beckford, who is literally changing the way we as women really tap into self-care. Because like Rob said, self-care isn't not selfish, but more importantly, self-care is a way that we can really improve our overall healthcare system. Like Rob said, my name is Quinn Conyers, and I have the honor and pleasure to really interview Dr. Beckford and really learn some tips, tools, and techniques that we literally can use, not today, not tomorrow, but right now. And here's what you need to understand about today's session. It is called Self-Care is Healthcare. And self-care is not just about feeling calm and cool and collected. It's important for our overall health. And Dr. Tamara Beckford, she is an emergency medicine physician. She is a busy professional mom who knows how hard it can be to find time to put ourselves first. And that's why I'm so excited literally about this conversation. So Dr. Beckford, before we get started, happy International Women's Day. How are you feeling today?
I'm feeling very, very good. And happy International Women's Day to you too, and to all our women, across the world. Hopefully we'll get to celebrate a little bit today.
Yes, absolutely. I agree. And it's great right now to be owning our power and doing some awesome and amazing things. So Rob talked a little bit about your bio. I talked a little bit about your background. And, I just want to know, I don't know the exact number, but before I did it before, I think the number of women and the number of Black women who are doctors is very slim to none, right? I think it's like less than 5%. So I would love to know, what actually motivated you to find, your voice, especially as a doctor in self-care and healthcare? Like, how did you get into this industry?
That's a very, very good question. And you're right. It's approximately 2% of us who are Black female doctors. And here I am an ER doctor, as you have mentioned, and so has Rob mentioned. And, emergency medicine, if I've never heard of it. It's a little bit of a stressful specialty. So we have a high stress level within emergency medicine. And then we have this added layer of the pandemic coming along. So as time progressed during the pandemic, I noticed that me, and along with my colleagues, we started to neglect ourselves a lot, right? We had this layer of, what is this virus that's there? Am I taking this home to my family? Will I be endangering my family, right? And then we also have the layer of, okay, we've had a shutdown. Some of us had to start parenting and become teachers at the same time. There are a lot of our colleagues. So that level of stress just started to really add up. And it became to a point where you started to think, well, what is the point? Exercising started going out the back door for some people, even eating nutrition meal, right? So you're just taking in whatever additional carbs and you're just trying to get by. But when you look around, you realize that instead of you really getting better, you're starting to feel worse. And as we are mentioning here, self-care is part of healthcare. So as I look and I noticed this amongst myself and my colleagues, I decided, I probably need to make a change. And so I decided to form the Your Curing Docs and the Your Curing Society. And with that, I, along with my colleagues, I said, okay, well, why don't we, especially as women, put ourselves first, put our health and wellness first for at least 2 hours a month without feeling guilty? Because that's one of the things that really adds to us as women. Whenever we try to do things for others or even for ourselves, we start to feel guilt for all the things that we feel we're neglecting to do for others. So I said, no, we need to do this for ourselves. And that's how I formed the Your Caring Docs and Your Caring Society.
I love that. Like, not feeling guilty, but giving ourselves grace, right? Like, we deserve a little bit of time out. And I think 2 hours a month is more than probably just the tip of iceberg. We probably deserve more, but I agree.
Absolutely.
Before we move on, Dr. Tamara, I have to just celebrate you.
Woo, okay.
The reason why I'm celebrating you is because you said you're in emergency medicine and only 2% are Black and female. Like, come on. We just can't push past that. So I wanted to celebrate you. And if you're watching right now, I want you to put in the comments, Dr. Tamara, right? Just give her some love. Like, she is breaking stereotypes, shattering misconceptions. I mean, it's one thing to be a doctor. It's another thing to be a doctor who's a woman. It's another thing to be a doctor who's a woman who's Black. It's another thing to be a doctor who's a woman who's Black, who's in emergency medicine, and it's International Women's Day. Like, we just got to celebrate that. So
thank you so much. I appreciate all that you are celebrating with me today. Absolutely. I'll take it all in.
Yes. Just take it all in. Now, you're a mother, you have a demanding job, right? And you talk a little bit about the importance of self-care without guilt, right? But what are some practical tips and tools that people can begin to use right away to practice self-care without it being overwhelming? Because some people think that self-care, or I'll say this, before we do that, why don't you define or redefine what self-care is? Because I feel like there's so much talk about this topic and we've all kind of got our own idea, description, how would you define self-care?
So self-care, to define it within oneself, let's just get the definition from one of the dictionaries out there, right? So we have Oxford. This is Oxford's version of the definition of self-care. It says this: the practice taking an active role in protecting one's well-being and happiness, particularly during times of stress. And when you really bring that down, it's basically taking time out for yourself to protect yourself so that you are happy and then you can be there for others. And that's one of the portion of self-care that people neglect. They're thinking self-care means that I'm always just spa, or I'm going on a retreat, I'm going on a vacation. When was the last time someone really sat and put together booking a vacation, especially if you have a family? There's nothing common about booking a vacation if one has a family, right? So self-care is, how do you take some time off for yourself? If you have a high demanding job, you might be taking care of not just little ones, but how about those in the sandwich generation, right? You're taking care of your elderly, or maybe you have an adult person in the family that you have to take care of them and the child. Taking a few moments to yourself can really impact yourself. Now you're asking, what are some ways to do that? Mm-hmm. Now, when we think of self-care, it doesn't have to be as exotic, as I said, as the spa retreat or girls retreat trip to an exotic place.
But those sound fun. Those sound fun though.
Those are fun. They are fun. However, it can start as simple as what we say, taking a walk, right? Taking yourself away from the environment that's adding the stress. Now, the stress of being a parent or even a caretaker, let's just be honest, that is a stressful role. Now, because you took some time away does not mean that you no longer care about those who you're around. You're just really protecting yourself so that you can give even more to them. Right? So there are also other techniques, such as, how about taking deep breath? I know some people are into yoga. Yoga is very good and it's important. The biggest the biggest part of self-care is breaking that stress cycle and bringing it to the restorative part of yourself, which is the parasympathetic. Restore and renew, reinvigorate yourself. So what does that mean for you? Does that mean that you like to read a book, get away? Does it mean, so for some people it is a trip, some people it's a walk, some people it might be yoga. How about even breathing techniques? Just simple, and there's so many added benefits of this too. You know, if we even want to talk about it, just doing simple breathing techniques can decrease your blood pressure. And if we're saying self-care is healthcare, there's so many benefits of ensuring that your pressure is under control. So we do have medications for that, but there are also some techniques, and this is part of self-care that I don't think a lot of people think about. They think spa, which is wonderful, but there are other avenues towards self-care that really has an added benefit to your health.
Yeah, no, I love that. And you said something so profound. I really wanted to reiterate that point. You just talked about the need for self-care, but also just highlighting the sandwich generation. I never really heard that before. The woman, or even the man or the caretaker who might be taking care of someone, an elderly parent, a sister, brother, uncle, but also still tending to their children. So, I mean, you're probably pulled every which way. So
Absolutely.
yourself gets lost. So I just wanted to highlight that. If you are a member that's in the sandwich generation, put a star by that and take some of these tips down so you can really, really, employ them in your life. Because again, if you are in that sandwich generation, there's probably even less and less time for yourself. So, thank you for sharing that information. So we do have a question from the audience. And if you guys are loving this conversation so far, just put love in the comments, right? I want you to know if you're loving this conversation so far, just put love in the comments so Dr. Tamara can really, really get some energy out of this conversation. So one of the questions is there a way to develop your self-care plan? But I'm going to switch this up just a little bit. I would know, what are some of the things that you do to practice self-care? Because there's some universal things, but people might not like bubble baths, they might not like vacation. So I want to hear from you, and I'll share something as you're kind of thinking about that. I have my own self-care. Here's one of my self-care secrets, and I would love to hear your perspective on this, is sometimes if I'm feeling overwhelmed, I'll shower 2 or 3 times in a day.
Ah, you're hitting those theta waves. So showering really puts you in a theta mood, and it's brings on a lot of creativity and ideas. Yes. If you think about it, how many great ideas to solve world problems have we developed in the shower? I know I do. I develop lots of ideas in the shower. Sometimes I look and I'm like, I need to be in here for 5 minutes. And, by the time you look, it's 25 minutes because you've gotten so many great ideas. So that's a wonderful, wonderful self-care technique. For me, a lot of self-care begins, I do a daily portion of self-care for me is really just reading in the morning. For me, my mornings are when I wake up, because I am an overnight doctor, so I work overnight. So my mornings begin in the afternoon. So the first thing I do is that I read something. And it's not, here's the most important part. It's not my Facebook, Twitter, or any of the social media. And I'm not reading my emails. I'm reading a book to either empower me or to bring calm or to enlighten me on a topic. And trust, I've started doing that over going on a year and a half, going on 2 years, and it has changed my life. So for me, it's just really starting and being intentional. So that's a self-care thing that I do daily. And being intentional with that, I enter my day. And so my day does not enter into me. So I'm not entering the day stressed because I read an email from someone who might have just sent it off and didn't even think about how I would feel. And then there goes the rest of my day. Stress, 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 still thinking about it, ruminating about this email. How dare they? Not at all, right? And then additional ways for me for reducing stress is that I love music. And that's the thing about self-care. Now, I do not sing well, but I sing well when I'm by myself.
Gotcha. And that's all that matters.
Absolutely. And that's because what am I doing? I am laughing, I'm enjoying myself, I'm releasing those endorphins. And those are all the positive hormones within our cells, right? When I'm enjoying all of that, I am there and I'm in a great mood. And another great thing to do too is the practice of gratitude. Like I said, if you're practicing gratitude, then it's hard to practice gratitude and be upset. It's hard to practice gratitude and be jealous. It's hard to practice gratitude and have a negative feeling towards things. So these are just some of my secrets, but I might add your shower technique to that now that you've told us about that. So those are some of the things that, and these are simple techniques for you to do. Some people do journaling. Journaling is a powerful way also to really incorporate self-care. And these are additional ways other than the yoga, meditating, breathing techniques that we've talked about earlier to add to self-care.
Oh, I love it. And yes, I mean, and here's what we all know, right? Because I know that the majority of this audience is women. When we say we need a shower, 9 times out of 10, we're not dirty, right? It's a way for us to decompress, right? It's a way for us to kind of like recharge, wash the day off, mentally like unload. And like you said, that's where we get our $1 million ideas. So there's a couple of things that you said that I really wanted to highlight. First and foremost, hashtag in the comments, shower self-care. Because some of y'all were like, oh, that's good. I'm gonna have to think about it. We might take one shower to get clean, but imagine if you're not feeling good, you want to spice up your day. Imagine taking 2 or 3 showers within a day. I mean, somebody else living with you, like, what's going on? She all right? But now this is a part of your self-care routine. You also talked about being intentional, right? Which I love. You talked about how you enter your day so the day doesn't enter you by making sure that you're limiting like social media, emails, by really focusing on really what I call bombarding your brain with brilliance. That's what I call it, right? So if you're like reading something that's like really good to the soul or journaling, like that's what you want to start with. And then number 3, you said as a self-care is really gratitude as well. And number 4, you said was journaling. So I'm taking notes over here. I'm making sure that if you guys are listening, that I'm taking notes because there's some really, really good nuggets that are being dropped, as we're having this conversation. So I'm just loving it. So I have a couple more questions for you because of course we're just having this conversation about, self-care and things like that. But, I think we talk about it a lot and I always like to go to the extreme as well. What happens if we are working moms? We are wives. We are giving everything to everyone. And we're talking about self-care and why we should do it. But let's just talk about some of the disadvantages of not practicing self-care. What happens if we don't journal? We don't take showers. We don't show gratitude. What is the end result of that, Dr. Tamara?
So that's a great question. And, we're highlighting the benefit of how self-care can impact healthcare. And so without practicing self-care, added stress, and stress comes in many forms, right? So how many of you have had this nagging discomfort within your body and, the tension in the shoulders? A lot of us, especially now, we're all working on computers, we have those strong tension within our shoulders, right? You have that added stress. Have you been checking your blood pressure? You are not noted to be hypertensive. You do not have a history of high blood pressure, but your pressure is just persistently elevated. You're tense. You're grinding your teeth at night, right? You have the tension within your jaw. It's just persistent. So these are some of the headache, the migraine headache that just will not go away. And it's just, I'm taking medication and I'm just not having any relief. So these are some of the aspects in our lives that occur when we do not take that break, when we're just under that consistent cortisol, stress. So it has a detrimental effect even on our health, not just those what we just described as those somatic, those are the medical terms, like the somatic symptoms, which means that you're feeling a physical manifestation of an emotional state, right? But you have truly detrimental effects, such as the heart disease. Now, how does that occur? You're under high levels of stress. Your blood pressure is persistently elevated. It's persistently high. Then you're adding now cardiovascular disease to that. If your heart is constantly under that pressure, the heart is a pump. Pumps wear out. And that's how the persistent stress can have its effect on the body, right? The persistent pressure is high. The body is just like a valve. The valve is consistently high, valves burst. Elevated blood pressure can cause hemorrhaging, which is bleeding to the brain. So all of these are detrimental end results of you having persistent stress, leading to high blood pressure, leading to uncontrolled pressure or other cardiovascular issues. And then you end up having strokes, heart attacks. So there is, even though there's a emotional manifestation of stress, the physical manifestation can be detrimental. And how do we break all of this? By really incorporating self-care. And self-care, as we said, walking, taking a breath, taking yourself away from that persistent high, consistent cortisol stress level, that fight or flight response that's just consistently going, breaking it to a calmer restorative, which is the parasympathetic portion, which is a restorative, calmer portion of life. Then we're able to reduce blood pressure, reduce the stress, and also reduce the chance of you having these detrimental effects from not practicing self-care. So it's more important than just painting our nails. It has great effect on the body.
Yeah, absolutely. And Tanya had a question, which I think you just answered about not being aware of the stress. Like, I mean, you just mentioned the feelings and things like that. So Tanya, I think that your question was answered. Christina has a question as well. Christina, thank you so much for joining us and asking your question. And she talked about, and this might be not just Christina, but other people in the audience. What if we can't go on a vacation? What if we can't take a second shower? Or what if we can't do some of the things that you mentioned? What can we do to change our environment that we're in to better promote or prioritize our self-care? Because we might have it written down and we have every intention to take that third shower. We had every intention to journal, but for whatever reason, our environment is chaotic. How can we still really prioritize self-care to make sure we are not at the end of the spectrum where we do have some of those health and emotional issues that you just mentioned?
Oh, that's a wonderful question, Christina. That's a wonderful question. And the way to do that, number one, is being intentional in your mind and that you will get it done. Number two, use the technology. That's what our cell phone alarms are for. You can add that, and there are actually people who have set alarms for certain times, and these are high power people who are setting alarms for certain times of the day. Every day, take 2 minutes to do deep breathing technique. And trust me, just those 2 minutes of doing that deep breathing, it snaps your body out of its high stress environment or the high stress cycle, and it breaks that cycle and brings in that restorative side portion. So one, recognizing that you are in a highly stressful environment and that it is chaotic. And two, being intentional that I will tackle this. And three, setting yourself up for success by adding it to either, if you're a journal person who likes to write out your planner, then you do that. If you use technology, set your alarm. Let you know that I'm going to take a few minutes right now to incorporate my self-care. And like I said, something as simple as just breathing exercises is just as powerful. Meditating is powerful. Meditating is hard. I've tried it. My mind wanders, but it has such great benefits. And the great thing about it is that you have to just keep trying it. You don't have to be great at it. You just have to just keep trying.
Oh, yes, absolutely. And you said so much in there, and I like that. And what I would add as well is, to make it intentional. And it might not be, like you mentioned, during the times of convenience. Like I know for me, I have a 4 and a 6-year-old. So I get up early. That's my thing. So you might mean you have to get up early or go to bed late, one or the other, right? So sometimes it's intentional, but it might not always be convenient, but it's still needed. It's still necessary to kind of find that. So listen, we are about to wrap up in about 3 minutes.
Wow.
Quick thing that I know time just flies when you're having a great conversation, right? If you would love this conversation so much, I mean, just put love in the comments again, because I know we're having a great conversation, but I want to make sure that we wrap up, on time. So if people, Dr. Tamara, are like, oh my gosh, I love this conversation, I want to learn more about what you're doing, where is the best way they can go to find you, connect with you, and learn more about what you have going on?
Oh, that's great. You can find me at yourcaringdocs.com. That's URCARINGDOCS.com. And you can always send me a message at Dr. Beckford at yourcaringdocs.com. Like I said, that's URCARINGDOCS.com. On the website with our Your Caring Docs, there is a section for you to join the society. And like I said, the Your Caring Society is here to help our busy professional women put their health and wellness first for at least 2 hours a month. And within the society, we have wonderful speakers, we have group coaching, accountability, and the most important thing is that we have support. So we're doing this together. So we're not leaving anyone behind. And like I said, only positive, supportive people we want in the society.
I love it. Not leaving anybody behind, making sure that self-care and healthcare is a priority. It doesn't kick or get any better than that, especially on Women's History Month and International Women's Day. My name is Quinn Conyers. I've had the honor and pleasure to have a great conversation with Dr. Tamara Beckford. And as always, make sure that you incorporate some type of self-care into your routine so you can make yourself a priority. With that being said, Dr. Tamara, thank you again for having this wonderful conversation. If you want to connect with me, I'm Quinn Conyers on all social media platforms, but LinkedIn is my jam. So if you want to connect with me on LinkedIn.